Hello, everyone. This is Joyce Davis, Penn Live's Outreach and Opinion Editor, who also happens to be President and CEO of the World Affairs Council of Harrisburg. And this is a dynamic partnership we have here between our council and Penn Live. So we're coming to you tonight to talk about a topic that is on everybody's mind, and that is just causing us, let's say, anxiety. Back to school. What is back to school going to be like? And tonight we have people who are very much involved in trying to make sure, first of all, that the schools reopen and that they reopen safely for parents, for students, and for staff, teachers and faculty. So with that, I'm not going to hold us up any longer. We're going to introduce who our speakers will be. And we have first Dr. David Christopher, who's with us. He's the superintendent of Cumberland Valley, and he's been with us before, and he's always willing to share his time and expertise. Thank you, Dr. Christopher.
Thank you. Thanks for having me. I appreciate it.
Absolutely. And we also have, of course, the president of the Pennsylvania State Education Association, Rich Askey, who's a teacher himself, so he can speak on behalf of teachers as well as those who are kind of watching overall what's going on. Welcome, Rich. All right. And of course, Dr. Dana Malakovich, who is with the Pennsylvania Department of Education, who's going to join us. And she is an expert, a specialty in mental health and emotional well-being. So welcome, Dr. Dana. I'll call you because your last name is a little bit hard to pronounce.
That's okay. That's what all the students used to call me too. It's much easier. Thanks so much for having me, Joyce.
It's a lot friendlier too, huh, Dr. Dana?
It is.
All right. And we have Lavette Henderson, who is with us, and she's representing and asking the questions that parents would ask. So welcome, Lavette. She's also a pretty well-known community activist. Welcome, Lavette.
Thank you for having me.
Absolutely. And of course, Nicole Kirksey, someone I have watched in action. She works grassroots with women as they try to grapple through their anxiety. Lots of workshops she's held with parents and with people just trying to figure out what their next step is going to be. So welcome, Nicole.
Thank you so much for having me, Joyce.
Absolutely. And the man of the hour, someone everyone has been waiting to meet, it seems, Eric Turman. Welcome, Eric Turman, the new superintendent of Harrisburg Schools. It's so great to have you here.
Thank you. I appreciate the invite.
Absolutely. All right, so let's get started. I already warned them I was going to pick on the superintendents first. So superintendents, let's start with you, Dr. Christopher. I mean, give us the overview of where things stand with Cumberland Valley, which is a huge school district, and just what you're seeing.
So, I mean, I think if you look back to the summer, end of June, we were feeling pretty good. I mean, I told my staff I was feeling good, like I could sing songs, like, we were ready to go. And then all of a sudden, in July, we started seeing just, more incidents of COVID, certainly in the South. And then we started realizing, hey, this is going to be a challenging fall for us too here, probably in the last, 5 or 6 weeks, really, I think. So, I mean, I think there is anxiety, certainly. I think our parents really want their kids in school. I mean, we were fortunate that our elementary students attended almost every day last year. I think we probably averaged more than 150 days in our elementary classrooms of kids face-to-face. But, our middle school and high school students were on a hybrid schedule out of the year. They didn't come back 4 days a week until, April. So I think families are very anxious to try and get back into school. And then there's just so much debate over the protocols that you should be using, and so much research and quasi-research and not research, whatever you want to call it, that's being presented. And so districts, I think it's challenging that it's just become so politicized. But districts are political entities. I mean, like, we have elected officials who make decisions and they have to get reelected sometimes. And I think that's a reality. And so, as superintendents, our goal has got to be to get our students in to school, to have them there every day, not to be quarantined, not to be sending tons of students out, keep them safe, obviously is an enormous part of that. And then try and stay in the whole year. I mean, I think that's really the biggest thing we have to do. And, I think also, Joyce, something that's a little bit different is I do believe that the public health issue that we were addressing last year has definitely changed. I mean, the number of vaccinated individuals, especially some of our older individuals who are more at risk for COVID-19, is very different. I think, like, the public health situation right now in Pennsylvania is not the same as it was when we came back to school last fall. But that doesn't mean that the situation is any better in some ways. I mean, I think we know more about COVID-19. We know better, especially about how it operates in schools. I think we feel more confident about it being able to keep kids in school. But I do believe it's going to be a challenging fall for our students. And I think our families are still, I think a lot of them are still in summer mode, and because they've had a very good summer. The kids in general have had a very good summer. They have been out and they've been able to do things, and we haven't had a lot of issues up until very recently. So I think that kind of coming back to school shock could be a little challenging for folks. I really do.
Now, are you mandating masks? Is that a mandate in Cumberland?
So what the board is elected to do is during high spread, we are mandated. So when we are in high spread, according to the CDC, the district is mandated to have masks. And we are using the early warning tracker from the Department of Education we used all year long last year to try and determine the level of spread. We're not using that CDC tracker, honestly, because it's a daily tracker, and the one from the Department of Ed is weekly, which we think is more palatable to our families. We just think if we are telling them every day something's changed, it'd be a lot.
Yeah.
But what we essentially have said is that, if we're in high spread on a Friday, based on that data tracker from the Pennsylvania Department of Education, we would have masks the following week. And then we would continue to have masks until we'd had at least 2 weeks where we below high spread with a declining number before we would go to an optional format. And we have a very divided community. I think a lot of places do, and real strong opinions about wearing masks. And we're trying to float the needle there a little bit, and trying to make sure that when we have significant spread, that we're making sure that there are not tons of quarantines. I estimated that during high spread, we would be quarantining somewhere between 500 and 1,000 students a week based on the case numbers we saw last year. We have 9,980 students as of last Friday in the school district. So, large district, but, if you had a tenth of your kids out on quarantine a week, that's not reasonable or a reasonable expectation for families.
Right.
So, we focused a lot on some of those metrics to try and ensure that, that we were being very clear with our families about this is what happens if we don't do it, but it's been a challenge. There's no doubt. I mean, I think we've had more public comment at the last 3 board meetings. If you look at the number of cards than we probably did the whole year before I was here. So.
Yep, this is a controversial, high impact kind of time we're dealing with here. And Eric, let me bring you in here, Mr. Turman. And what are things looking like in Harrisburg? Is there also this level of division within the population, the school population, or are people generally on the same page in Harrisburg?
I'm going to say people have been on the same page. And that's kind of been a blessing for me my first year being a superintendent, where, it's been kind of united from the board of directors all the way to the community. When we came out a few weeks ago and said we were going to do masking for all, including all students and then all staff, I really didn't hear anything negative coming from the community at all. The board of directors were very supportive of it. So it really has been a community effort in terms of saying that we talked to a doctor from UPMC a couple of weeks ago, and he said, follow the science. And follow the science is that if you have students and folks wear a mask, that will definitely be one of the reasons to prevent transmission. So in listening to that and talking to those at the administration building and talking to the receiver as well, we were all in agreement that everyone's going to wear a mask. And, we will make a determination down the road whether or not we want to lift that or what it may be. I do agree with David, the going back and forth, where, 1 week it's this, the next week it's that. It's going to be a lot easier for continuity purposes. For us, it's just going to be masking for all. And we will probably look at it probably at the end of the first marking period, give ourselves 45 days in school before we make a determination if we're going to go in a different direction. But the number one thing, and I don't want to echo what David says, you want kids in school. And the unfortunate part for these students at Harrisburg is majority of them have been out of school for 1.5 years. They only brought back students from the elementary level last year. I believe it was just K-2. So you're talking about high school students who have not stepped foot in John Harris. We did have some programs over the summer where students were able to come into school to kind of get reacclimated to the environment and try and close some of the learning gaps. But that's still not the day-to-day coming into school, being with your classroom teacher. So that really is our number one mission. So if that means that every student has to wear a mask, And that's what we have to do all year to make sure we keep students safe, make sure we keep schools open. Then as a district, we'll make that decision, and that's what we'll do. But the number one priority from the jump was keeping kids and staff safe and keeping kids and staff in school. And that's really the priority. So whatever we need to do to make sure that happens as a district, that's what we'll do.
Right, and Rich, I'm going to bring you in here since you're going to represent the teachers. You've heard what the superintendents have said. Does this ring right for you as you're looking at the teachers going back as well?
Well, PSEA is calling on every school district in Pennsylvania to follow the Center for Disease Control and Prevention's most recent guidance on mask wearing. So throughout the pandemic, our top priority as an organization has been keeping students, staff, and their families safe and in healthy school settings. And if you're going to achieve that, you have to have confidence in the scientists who are studying this ever-changing virus and developing the data-driven information, which is really, you heard the superintendents talk about the importance of having true, and I do want to emphasize true information. You know, PSEA, just like the two gentlemen who just spoke, our members want to see our kids in school the first day, the second day, and continue throughout the year until day 180 is done. We want our kids to, we know that the things that happened last year with hybrid learning, school not being in session, and our students have developed, have experienced a learning gap, that we need to fill that gap. And we need our kids in school every day. This is not about politics. This is about our kids.
Well, amen. But I want to come back to you guys to also talk a little bit more about vaccinations and all of that. But before I do, I mean, I've heard that clearly people are worried. There's anxiety. So we're dealing with the virus. We're dealing with the physical side of the virus. We're dealing with the emotional turmoil that all of this is causing. So Dr. Dana, I want to bring you in here because this is your field and you're looking at this along with Nicole. What are you seeing? What are you advising?
Joyce, I think, the reality of our situation is that we are entering a school year where, as the superintendents had said, and as Rich had said, many of our schools across Pennsylvania, we're not in school. Many, some brought it back elementary, some didn't bring back any, some stayed hybrid, but the reality is that we have a large number of students who are not in school. And so what we need to focus on is that, yes, every single family, every student, every staff member has really been exposed to a traumatic event. And when I talk about that, I really like to focus on, we know that, we know we've all experienced a traumatic event. We know that while the data isn't out, we have higher rates of depression, we have higher rates of anxiety, we have higher numbers of youth reaching out for mental health supports. But what we're unsure of is, are we seeing higher rates because solely this is a trauma response and we have significant levels of trauma? Or is this partially due to, we're talking about mental health all the time. And that is one of the things that came out of the pandemic is we're discussing mental health now. It's not that thing that we hide anymore. The stigma is reduced. It's okay to ask for help. And we're seeing a lot more supports out there. So I think when we're moving forward into the new school year, we often think solely of the negatives. Anytime we think of the pandemic, we can list an entire litany of negatives that have come out of the pandemic. And what we've really been trying to focus on is, how do we find those silver linings? How do we start looking for the resiliency in our staff and our students and our families, and really thinking about things like, okay, when it's okay to ask for help if you're sad, it's okay if you're scared or you're having difficulties with mental health, it's okay to say, I need help, to reach out. There's text, there's chatting online, there's telephone. Telehealth has, really come in to play much more. And it's also something that we've seen with our educators. We've seen our educators be so much more open about, I'm really struggling with this. When we say self-care and we say we need organizational self-care, we're starting to talk about school systems needing to do self-care, from the administrators all the way down to our educators and inviting our families in for self-care, thinking about how we teach our students self-care And that's okay now. It's not something that's we just like, oh, well, you're saying that word again and I don't want to hear it. So that has been a positive that has come out of the pandemic. And the other thing that I think, that I've seen across Pennsylvania that's really been a positive is the relationships are so much stronger. I have heard from families who said, I haven't ever talked to my teacher, my child's teacher this much. Teachers are reaching out to community members. Communities are reaching into schools and saying, we're here to help you. How do we develop partnerships? And so thinking about that has been really positive. And one of the things we've looked at when we think about how you help is we've looked at how do we continue that? How do we know that we need to address the learning loss? We know we need to address the social emotional difficulties that we're going to face when we come back. But we also want to keep the positives. We don't want to go back to, okay, now the pandemic is, we're moving into a different stage of the pandemic. And so we're going to throw those relationships away. We're going to stop talking about self-care. We're not going to engage in resiliency practices anymore. So the department has really been focused on that throughout the pandemic, thinking about, well, what do we know is going wrong? What is going right in different communities? And how do we develop that? We have a ton of resources on PDE's website, but I wanna, when you were talking about families, I think, the one I really wanna hit is we have resources for families. One of the things we did as a department was we have a lot of parents in at PDE, and we all said, all right, let's take off our PDE hat and let's talk about the fact that we're experiencing this too, and what do we need? What do we need as our students, our children are our students? What do we know that our family members need? When people talk to us and they are stressed out, what are they saying we need? So we have family resources that focus on exactly what you were talking about, Joyce. What do I do when I am completely stressed out and I have a child who is stressed out? How do I help them cope? We're looking at helping youth cope with their emotions and develop resiliency. And then, of course, we have resources for schools as well, and really focusing on the learning gaps that Rich was talking about, and focusing on the social emotional and how you tie that all in together. Because ultimately, what we want to see when every single staff member and student goes into a school is they walk into a building that feels safe and secure and they belong there. So really hitting that first, because we know we don't learn if we don't address the emotional aspects of it.
Very good. Well, that's pretty comprehensive. And I want to come back to some of those points too, because one of the things we've been hearing is that there really aren't enough counselors in these schools to kind of deal with what we're going to be facing. But okay, Nicole, you heard the comments that Dr. Malakovich just made, and you're working with women on the, in right in the neighborhoods, and unfortunately a lot still online. But what are you hearing? Are you hearing a great deal of stress? And what about the anger factor that I also know is out there? People are just angry about where they are.
Absolutely, absolutely. Well, in my work as a coach, and also as someone who works in higher education, I'm an educator of adult learners. I'm in contact with over 200 people, fairly intimate contact, conversations along the way about what's going on in their lives, and offering them different levels and different types of support. And so as we were preparing for this, I really thought about sort of categorizing folks into sections, like what are some of their frustrations and what are some of their anger. I know that Dr. Dana talked about some of the positives and the silver linings, and those things are really true. I agree with a lot of those. But in the meantime, people are still really adjusting. All of this is always a new normal that seems to forever be moving and shifting, and people are really struggling. I was interacting with a teacher earlier today who decided not to go back to the classroom in fall, for example, because he was not able, he felt like he was very frustrated with all the dialogue that the students were not being kept safe. He's in an area where there is no mask mandate. He's concerned about the safety of the kids in his classroom. He's concerned about the safety of his own child. And he is a caregiver to someone who has a medical condition. And so he was doing a negotiation, trying to work, I guess, in a hybrid situation, and wasn't able to. And so he tendered his resignation today. This is a decorated teacher who had been so committed to the online classroom, but felt that physically and also psychologically, it was not a safe place to be, and so had to make another decision. And I think that's so hard on our students, right? And on our system when we lose valuable people that way. I've also had the opportunity to talk one-on-one with moms of children. One mom that I talked to has 2 high schoolers who are going back. And she felt confident because she was able to get her son and her grandson, these are the kids that she's caring for, she was able to get them vaccinated. They're in a very high level, as the CDC says, area where COVID is spreading. But she has been coaching them all through the summer. They are ready to go back, obviously, to get back into sports and with their friends as more mature students. But she's cautioning them to remember the social distancing and the masking, even though that they are vaccinated, but she feels more confident with that layer of protection from them. And then I talked to a mom of a younger student who doesn't seem to have the same kinds of concerns. There is this notion that COVID is not impacting our younger kids as much, although we know that the numbers are going up. Some of the data is not really sure if it's a rate or proportionate, so since the numbers are going up with the Delta versus Alpha, we know that. Are we really seeing more kids in terms of a proportion? So she was saying, well, it doesn't really affect kids. So I had to send her some information today, say it absolutely does. But that kid said out loud, the child is under 10 and said, I can't wait to get a vaccine. Because the kid felt like she didn't want to have to continue the worry that she felt in the people around her.
Right.
So a lot of the adults are having, mental and emotional and physical responses to the adjustments of the pandemic, and it's really real. I do think that the good thing is that we are talking about things that we never talked about openly before: our emotional health, our reliance on social supports, our willingness to ask for help and collaborate and get help when we want. A lot of communities are willing to get professional psychological help where we haven't been willing to do so before. So I think those are good things, but we do have to keep in mind that as adults, we have to take good care of ourselves and model for our children, because they are picking up on our energy and our fears and the things that we share as well.
Absolutely, absolutely. Well, Lavette, I'm going to bring you in here. You're a parent, and are you modeling for your children? Are you anxious, or what's going on? Tell us.
I feel anxious, confused, worried for everyone's child, especially in communities where the education is already unequal, and the districts are overcrowded. I did want to ask Dr. Malakovic, do you see a difference in the numbers in urban compared to suburban communities?
I don't think Dr. Malakovic is keeping those numbers. That's for the Department of Health. So let me stay focused on you, and I'll ask the question.
I'm sorry.
That's all right. Let me just stay focused on you. When you
as far as
parents, when you talk to other parents, and when you talk to, as they're getting, what are some of the things that they're telling you? Are they in favor in Harrisburg of the mask? Are they in favor of vaccination? What are they saying?
Most people aren't in favor of getting vaccinated. And I really haven't got much feedback about the mask mandate. Personally, I'm going to, make my children wear masks because I do have a son who's asthmatic. But I think most people in my community are afraid of the vaccination and not willing.
Okay, that brings us back. That brings us back to our superintendents and to Rich. What are you telling parents and teachers about the vaccine? Are you encouraging them to take it? Is there a mandate coming for them to take it? Dr. Christopher.
I don't see a mandate coming, to be honest with you. I think that would just be too political. But we did I think a really good job last year with our staff in getting them vaccinated. We're over 90% of our staff are vaccinated that we know of right now. And had a very positive campaign about vaccines, I think, here for our families as well. So we have been very straightforward in all communications that getting vaccinated is the number one way that you can protect yourself, that you can stay in school, We've been pretty clear about it. And we've had good numbers of individuals who are vaccinated in Cumberland County, I think, in general. But, you still have those holdouts. I mean, there's still folks who are very concerned about it. I have no idea what my student numbers look like. I'm not sure. We really have opted not to try and track that, just because I think it could create a whole additional, challenge. And we're not actively tracking our staff member numbers either. We just know how many people actually signed up for our vaccination clinics that we offered last year in the spring. But, it really is a big difference. I mean, right now, if you're vaccinated, you don't have to quarantine. So if you're a student and you're vaccinated, you can continue to come to school, even though you have to be masked and we have to watch you, and you really should get a test within 3 days, around 3 to 5 days after you are exposed. You wouldn't miss any school at all, or sports, or any of those other things, I think, that are just so important. So, I think that message has been pretty loud for our families.
Yeah.
But yeah.
I guess I'm a little baffled why you wouldn't want to keep track, though, of who's vaccinated, because that would give you a sense of just how, is it just that it's just too much work, too much record keeping, or?
No, it's just, once again, it's such a political issue. And there are situations where, where you're going to have to produce a vaccination card. Like, it's not the honor system if you don't want to have to quarantine. You have to be able to demonstrate that you're vaccinated, but we're not keeping a database of it, I guess I should say.
Okay.
There would be opportunities where we would say, hey, you're going to need to provide that if you're a staff member or if you're a student. But that's really in working in coordination with the Department of Health. One of the big misconceptions is that Cumberland Valley is doing all these quarantines. The Department of Health is doing all the quarantines. Cumberland Valley is just helping them contact trace. That really is how that is operated. I had the opportunity yesterday to talk to Peter Blank, who's the director of policy for the PA Department of Health, and really he kind of just clarified some of those things for me. And that's a really big issue, I think, for a lot of our families, is they think these are optional. You guys can do what you want with quarantine. Like, it's not up to us. It's up to the Department of Health, which I think as more of that language is coming out, and the more communication we have, the more they say, okay, getting vaccinated really does have these benefits potentially beyond just not getting sick. I do think you're able to get some of those numbers up in our region. And I think last year I did 23 videos to our families.
Yeah.
I collectively had more than 100,000 views, and in a lot of them I was talking about vaccinations and people need to get vaccines. We got to move that direction.
So you have done videos actually encouraging vaccination.
Yeah, in a lot of our videos we did, absolutely.
Okay.
And the district ran clinics for our staff on site. And then actually participated in the big clinic with our intermediate unit. But we actually ran a clinic on site for our staff, and our families were completely aware of what we were doing, because we actually closed school today, because the day after all of our folks got their second shot, we realized we would be down about 100 subs and we wouldn't be able to operate. So, we were very open about what we were doing and why it was important.
Right. Well, Mr. Turman, I want to bring you in here because you heard Labette, say that many people in the Harrisburg community, and I'm thinking she's talking about Black people there who are sending their kids to school or are afraid of the vaccine. What is the school district doing to try to encourage people? Look, in all full disclosure, the World Affairs Council is signed on to trying to help encourage vaccinations. That's what our position is. We think you ought to get vaccinated. So are you guys doing anything to encourage vaccinations, Mr. Turman?
And we have this year. Over the summer, we had a lot of working with Hamilton Health. We had a lot of, they were coming out to some of the sites, some of the schools to help with vaccinations for the community. So we had maybe, say 4 or 5 days this summer within coordination. We were doing that to kind of help the community and also the students who are of age to be vaccinated as well. So that was one of the initiatives that we moved forward with. We also, from a staffing standpoint, sent a survey out within the past week as teachers and folks are coming back to school to survey the staff to see who has been vaccinated. And then all of that information is going to be kept privately in our HR department. And they go back to what David said is kind of to go after some of that contact tracing. And then, and then if at a point where a staff member is vaccinated, then once again, they would not have to quarantine. So we are probably at about 80% of the staff have filled the survey out, and we are going to make another push, try to get between 90 and 95% of staff filling the survey out, so we know exactly who in the district has been vaccinated, who is not. We do have other plans, which I can't really speak to yet because they have not come to fruition, to help with staff who have not been vaccinated, in terms of how we could support them. So there's some things in the works, but I don't like to speak about something until I know we have everything ironed out. So we are coming up with plans to help with those who are not vaccinated as well.
So this is a priority for Harrisburg too. I mean,
Absolutely.
but
Absolutely.
again, what I'm talking about is not only just the school and the teachers,
Right.
but parents. And
Right.
are you working on that as well to deal with parents?
Correct. And that's why it's
Okay.
a lot of the clinics that we're having have been open to the community,
Very good.
where there's no sign up, they can just show up,
Yeah.
and they were getting vaccinated on the spot. So we will hopefully look to continue working with Hamilton Health to continue that as we go throughout the school year. But some of those things, like I said, a lot of those conversations are happening in terms of what we're going to do as we start the school and continue forward. And the only thing else I can kind of add to that is, we want to try to bring folks in to help educate the community, because I think a lot of the reason why folks may be a little bit hesitant is it's all about education and about understanding truly what it is, what it can prevent, and there are some folks who have a strong opinion about it, but their opinion may be coming from someone else and not coming from the right person. So those are things that we are looking to do in the future, and bring folks on site and to work with our community to help educate them on what are the reasons for getting vaccinated, and then how it can help them and also their child.
Absolutely. And Rich, are you guys asking, or the teachers union asking for a mandate on vaccinations, or are you leaving it again up to individual choice?
We are not presently asking for a mandate, but we have been encouraging our members to get vaccinated. We all see the science, and we all know that protecting our students takes multiple layers of protection for them, from masking to social distancing to vaccination. Our kids need to be surrounded by people that are vaccinated. So like many of you probably remember, PSEA worked closely with Governor Wolf to have that program in March where the J&J shots were sequestered for educators in Pennsylvania. That was extremely successful. We felt very good that we got as many of our members vaccinated in 2 weeks' time, when we thought it was going to take 4 weeks' time. So we estimate that in Pennsylvania, 85 to 90% of our members working in public schools are vaccinated. So we feel very, very good about the work we've done in this area. But as far as like mandates go, that needs to be done. We feel right now our position is that that's being done at the local level.
Okay.
And we hope that our superintendents and our school board members and everything work with the local leaders there to create policies that fit that school community when it comes to vaccinations. But we do realize the importance of vaccines in protecting our kids and keeping schools open.
Right. Lavette, do you think that the school system would have an influence on parents? I mean, if indeed, Mr. Turman, and they started really pushing this, you think the parents would be listening? I mean, I know you're going to be out there trying to encourage vaccinations, but do you think they're open, their minds are open to listening to this?
It's possible. Education and information is the best thing that we could do. But I think that with COVID-19, it's a sensitive subject, and like pushing the vaccination on someone is like a personal health issue. So many people don't, like, even if you ask them if they're vaccinated, it's like really none of your business. So I think the best way that we can approach the vaccination is just by putting the facts out there and being informative, and let others make the decision for themselves.
Mm-hmm. Well, I have the benefit of just having completed this morning a course on trauma-informed whatever. And so I'm going to turn to our mental health and emotional health experts to talk to them about the right way to approach this, because someone like me would beat them over the head and that would get us nowhere. So Dr. Dana, give us the tips on because as we understand, there are different reasons why people are refusing or are hesitant. And some of them actually are not illogical. Some of them make sense. If you're looking at history and you're Black and you see the experiments that were done, that might cause you some squeamish. But talk to us about what are some ways that those of us who really care about this can do this in a way that is going to be actually effective.
Well, I think in terms of vaccines in general, I mean, I'm really leaving that with the Department of Health and focusing more on the mental health. But, you know, one thing that you just really hit me, Joyce, is that trauma-informed part. And so whether we're a community agency or we're a school, really doing everything in a trauma-informed way, whether we're talking about vaccines or we're talking about mask mandates or we're talking about coming back to school or we're talking about learning loss. How do we really think about making sure we're communicating in an informed way that we are not alienating our families and our communities? So really being transparent. We had a lot of conversations in the beginning of the pandemic with different superintendents and school systems saying transparency is key. Like everything changes, as we've heard, you know, through many of these panelists today. Everything changes. You don't know what next week's going to look like. So you need to be willing to say to your families and your communities, this is what we're doing right now based on what we know right now, but that may change. And that doesn't mean we're being not honest. It means we don't know what's going to happen next week. And what we found is that communities who are willing to say that have families who are willing to say, okay, we're going to work with you because they feel like they're part of it. They feel like they're part of the solution rather than they're constantly waiting to see if, you know, we're going to say one thing and we're going to do another. And when you talk about, you know, past trauma and, you know, things that have happened in the past, that is something we have to make sure that we're addressing and knowing that community trauma is a real thing. And we have to make sure that we're saying we understand that our communities have been through a lot. And we understand that we're going to address that in a very trauma-informed way and not say, well, we're only focusing on now. We can't just focus on now. We need to focus on why our communities feel that way and make sure that we're really creating safety and security in the schools so that our families do feel honest, are able to be honest with us about their hesitancy with, you know, with coming back to school or whatever it is that we're talking about.
Right. And I think, you know, part of the thing that I'm hearing too is we can't assume we know the reason either.
No.
We can't assume. So Nicole, when you're talking to people, are you sensing people are afraid or there's something that has happened in their background that is making them not trust and not believe in science?
You know, I've really been surprised at some of the folks who have been hesitant about vaccines and where they're getting some of their information. The campaign of disinformation and misinformation around vaccination has been prolific and has impacted many communities. African-American communities, I feel like, have been targeted. I've seen so much information, misinformation around Tuskegee that has not been accurate and is not related to the vaccine at all. But this is the information that people have, and this is what they're going on. And BIPOC communities, Black, Indigenous, and communities of color are not the only targets of mis and disinformation. We know, talking about, you know, political leanings and age and different parts of the country have also been targeted. With the impact being the same, low vaccination rates, high rates of COVID, and a higher disproportionate impact of not only the physical effects of COVID, but the mental and emotional health impacts of COVID. I know some studies have talked about how many people of color in general, but particularly Black people, know of a person in their family or in their social circles who have passed away of COVID, who are living with long COVID, who have lost their jobs due to COVID, who are on the cusp of being evicted because of COVID, who are taking care of multi-generations because of COVID, who haven't been able to get health care, weren't able to get health care before, but are fearful of going to hospitals because of COVID. And one of the things that came up in our conversation here is this notion of, if I just ask people, I'll find out who's vaccinated and how many people are vaccinated. I am finding that people are not only saying it's none of your business, but they're giving misinformation because they are embarrassed for people to know that they're not vaccinated. And so they say they are when they're not. And we are making assumptions that people will tell us the truth just because we are asking. And that's not always the case. We're not, the only way to be sure is to keep accurate information, medical data on who's showing up for the vaccine, 1 vaccine, 2 vaccine, and now we're on boosters coming up in September. So keeping records from there and being able to see what rates we have.
Wow, that's interesting. People even lying about their being vaccinated. That's true. That's also on the agenda there. Well, there are questions that are coming in, so I'm going to turn now to take some of the questions. And there is one that has been given to Ms. Henderson. And Kennedy is asking. Kennedy was one of our interns this summer. She graduated from Harrisburg High and is now at Shippensburg. And she's asking, what are some of your concerns, Ms. Henderson, as an involved parent regarding the virus and equity? I think she's talking about the kind of education and how COVID has impacted the education in the Harrisburg School District, I'm assuming. Do you want to address that, Lavette?
It's unequal. I mean, we're already in a district that the quality of education was unequal before the pandemic. So, and the schools overcrowded. Most of the schools are overcrowded. So not only are we dealing with a pandemic, we're going to be dealing with a crowded school year. Based on that, my fear is that the children will begin to come home with COVID, or you'll begin to see the symptoms of COVID in our children. For any minority community, that's my fear.
Mr. Turman, what are your thoughts, especially here with regard to the lost time, the lost opportunities that so many of the children have experienced, especially perhaps in districts that don't have all the resources? At least Cumberland Valley has a lot of resources to throw at things, but Harrisburg just doesn't.
Yeah, I mean, there's a couple of parts of this. Number one is, we are going to have some after school activities and also tutoring for students to try to go make the day a little bit longer for kiddos, because we know the amount that was lost within the past year and a half. Also, the other part too is all districts receive something called ESSER funds. And with those ESSER funds, you have money that is slated for learning loss. So, the district is coming up with plans in terms of what we were going to do to help with the learning loss that children have gone through over the past year and a half. So the one thing that, as I have talked to staff about and I've talked to all is, how do we come out of COVID better at the end than before COVID started? So there is funding now that all districts have an opportunity to get a piece of, where you're going to be able to do some creative things where, if COVID doesn't happen, you probably financially are not able to afford them. So, we're looking at it as an opportunity to do some different things for Harrisburg students, just not for the next year or two, but for the foreseeable future. So how do you capitalize on what has occurred in order to create a better school system for all kids moving forward?
Right. And I want to ask Dr. Christopher, I was just bragging about how much resources you have. Do you have enough resources to deal with this, especially the mental health things we've been talking about here? Have you been able to bring in additional counselors?
We have not necessarily amped up the number of counselors that we have. We added 3 social workers in the last 2 years who were very busy last year supporting students, but our student to counselor ratio is still pretty high. And really, our counselors spend, especially at the high school, a lot of time actually on college applications and preparation and things. But we have worked with some outside agencies to provide additional mental health services in the district. We are the fastest growing school district in Pennsylvania. We are averaging 200 to 300 additional students a year. We're building a new building every 2 to 3 years at this point. We just opened a new 9th grade academy to try and address some of that. But we also had a budget that was $6 million, a $6 million deficit this year. So, the budget's $165 million, and we had about $159 million in revenue. So, I think the resources, the challenges that we have are obviously different than Harrisburg has. We don't have historic poverty numbers like Harrisburg has either. And hopefully some of the resources that are coming out of ESSER, like we received a very small amount of money from the federal government as part of the of the era for the size of our school district. I think all in we're maybe about $6 million in total funds. And Harrisburg has received a substantial amount of money compared to that. But the challenge for Eric is it's one-time funds. You know, it doesn't necessarily doesn't increase your budget. It doesn't provide you with some of those other things. I mean, so really that ongoing cost is really where all those things are. So I think we're in a position to address a lot of issues. Our kids also, you know, like I said, they were in school a lot last year. I mean, like we really were able to get most of our students at the elementary level in school, you know, which I think is a huge impact difference, you know, comparatively. But we had a lot of students who struggled too. Don't get me wrong. We had a lot of students who opted to be virtual and then couldn't do it. You know, weren't really prepared with their family to manage that. So I do anticipate as we're coming back, we've talked quite a bit about the mental health aspects. We're going to be doing a specific student climate survey. We've done this in the past, but we're actually going to try and align it directly with each kid. So we'll actually have students actually sign in to take this survey so that we can start really using a dashboard to say, okay, where are our at-risk students? How can we address some of those at-risk students' concerns, you know, very quickly? You know, and also how can we then look at how we're doing with school climate? You know, Joyce and I, you know, I've talked quite a bit about school climate previously at Cumberland Valley, and we've made a lot of strides, I think, in the last year and a half. But now we really want to say, okay, here's our baseline coming back from COVID. And maybe at the end of the year, where are we? What were we able to do and what were we not able to do? You know, because we need to try and address all of the mental health needs that are coming in, either directly or, you know, with services and with referrals, because we know students aren't going to be successful if they have those mental health challenges. You're not going to learn well, you know. And so we actually spent the entire afternoon today. All of our teachers did a training on social emotional learning that we put together with our team to try and really ensure that they all had the tools in their toolbox coming back and knew what the referrals were, knew how they were going to be able to manage some of these things on day one, you know, when kids came back to school.
Right.
So those are the types of things we've been trying to put in place. We actually, our spend per kid is surprisingly low. You would be surprised to find out what our actual cost per student is for the district. I think the biggest difference for us is the relative wealth of families. You know, obviously, you know, and the kids are not coming to us, you know, with some of the challenges that Eric's going to see because of that multi-generational poverty that he's dealing with in Harrisburg.
Right.
You know, and so, I mean, I think, you know, it's really interesting. You know, you have these very different school districts in this region. You know, in terms of how they were, what they were able to do during COVID and what worked and what didn't. And, you know, I really do think, you know, we have to be really cognizant of how we try and ensure that all of us are coming up together. You know, luckily we do have a good superintendent's advisory committee here at our intermediate unit. We spend a lot of time working with each other. We share a ton of resources with each other. You know, a ton of ideas to try and be successful, because none of us are an island. You know, we really aren't. And what's good for the community is good for the community.
Absolutely. Rich, I wanted to bring you in. You've been hearing some of this, and we haven't talked also a little bit about the emotional needs of teachers. I mean, your teachers, especially those who are dedicated teachers, must be just at wit's end trying to figure out how they're going to make up for some of the lost time, and how are they going to, you know, grapple with the kids who need extra help during this. What are your thoughts with that?
Well, absolutely. And thanks for bringing that up, because the educators and not just the teachers, the support professionals who work with the students in the schools, they've been so, just like we've all been stressed out over this pandemic. That's a reality. We have to first stop and recognize that. But on top of that, the educators have been really focused on the students, creating online courses all of a sudden, like they had to turn around and do it on a dime. Yeah. Then they had to do hybrid. Then they had to teach live and online at the same time. And the expectations that the folks who serviced the kids in our schools last year was immense. And they were heroes. They were absolute heroes. And now their big concern, and I hear this from a lot of members, is the social and emotional wellness of their students. That's really what they're focused on. But they also tell me that there is the stress, that they feel the pressure about filling that learning gap that the students have experienced. So we have responded to them. We have programs such as Wellness Wednesdays and Thoughtful Thursdays, where we bring our members together so they can share and we can hear what their issues are and find ways to answer them. So it's important that school systems not only provide for the wellness of their students, but as Dr. Dana said earlier, for the wellness of everybody, from the administration to the teachers, to the paraprofessionals, to the students. It's a community that needs some love, basically, right now. It's a community that needs some love.
Absolutely.
And the good news is, we've referred to the resources coming in. With the American Rescue Plan, I just want to point out that $5 billion is coming into Pennsylvania, has come into Pennsylvania schools. And the good news also is that it can be spread out over a few years. It's not just this year. Districts can make a good, smart, thoughtful plan over the next few years. And we are speaking with our members to make sure that they work with their school districts to do that. And I just want to make one final point, the inequities. This if I hadn't left for this job a few years back, this would have been my 37th year in Harrisburg School District. So I am very aware of the inequities. But the good news, if you can count it as good news, is this pandemic shone a bright spotlight on those inequities. And so now we can have real discussions about it. And we can, out of those discussions, it's our responsibility to find answers for these kids.
Absolutely. Absolutely. Dr. Dana, that brings you in. I just love that he talked about the money that's coming in. I'm sure you're having something to do, your department, with how that's going to be distributed. And are you able to give any more resources, mental health resources, to bring in people to help, and also to help parents? I'm wondering, even with Lavette, does she know where to go when she needs help? But go ahead, Dr. Dana, and then we'll get to Lavette.
So we have been focusing on, as a department from the beginning of the pandemic, how do we address the mental health and the wellness needs of our staff and our students and our families. So we started out previous to last school year with, it was called a roadmap for educational leaders. And one of the guides that we put out was staff and student wellness. And it really was a checklist for districts. How do you go through communicating with families so they hear you when they are stressed out? Like making sure you're speaking their language, that you are not putting jargon in, that you are really being very clear and concise, like not just regular communication, but focused communication for stressed out families, because we know our families were stressed out. And then how do you take care of your staff? Because if we don't take care of our staff, they can't take care of their students, and then we can't take care of our communities. So we built on that with the accelerated learning through an integrated system of support. And so the resources are there, and we really worked very hard with our intermediate units and the Pennsylvania Training and Technical Assistance Network, which often is just coined as PATN. And we really partnered over the last 6-8 months on looking at what does it look like going forward. We can't just put something out for another year, but how do we address that sustainability? Because when you think about, yes, there are $5 million coming into Pennsylvania. So we are very excited about that. And all of the buckets related to the ARP ESSER funding really has been focused on, okay, how do we address mental health? How do we address social emotional learning? And you have to address learning loss associated with social emotional learning as part of the funding. So all of that was wonderful. But what we didn't want to see was we spend the money on a staff member, the money runs out, the staff member goes away, and now our students are exactly back where we were before. So our technical assistance from a department and the resources that we're continuing to develop really look at that sustainability factor. Looking at how do you partner with intermediate units? How do we increase the capacity of our intermediate units to be able to provide technical assistance to our schools? And really putting those resources out, as Rich noted, really making those plans. The whole goal of accelerated learning is that planning. So you're doing your needs assessment. You're looking at your data around student needs, around disproportionality with mental health, with academics, and really tailoring a plan for that. And then one thing we've had in Pennsylvania for a very long time, and we're one of the few states to do so, and several other states are actually modeling off of what we're doing, is we do have the student assistance program in every single district. It is mandated, and it is a mental health referral system or drug and alcohol or anything that impedes a child's learning. So educators can refer that, administrators can refer that to that, but parents can also call and say, I have concerns and I need help. And the student assistance program is a process that really takes you through looking at everything happening in the student's life and partners with community liaisons who have been specifically trained to work with families and schools and really get that parent input. And parents are such an integral part of that. And so that has not gone away, and that is funded through an interagency collaborative with the Department of Education, Department of Human Services, and Department of Drug and Alcohol programs. So that is something that is very strong. There are coordinators throughout the state to really help schools with that. And that addresses some of the mental health needs when we think about how do we address right now, because we know that it isn't as easy as saying, here's a lot of money, go buy mental health professionals. As I'm sure Nicole can attest to, we have a shortage of mental health professionals. So we have looked at that. And then Pennsylvania Department of Education also has a new social work certification. So that's another avenue looking at how do we get more social workers into our schools as well. So we've been working on this it's coming out, and we're continuing to brainstorm, talking to other states and saying, how are you addressing this? What have you found worked? So that we can benefit the schools throughout Pennsylvania as well.
Thank you. And I really want to do it practically now to go to Lavette. Lavette, let's just say you were just having a meltdown and you needed to talk to someone, or you were concerned about your child. Do you know, what would you do? Do you know where you would go, who you would reach out to? Is that all clear enough to you as a parent?
For me personally, yes. I don't know if it is for others, but yeah, I would know who to reach out to.
You would know. So who would you reach out to so that other parents will know? So, okay, I need some emotional support. Here's where you go. Here's what you would do. What would you tell them?
To call like a mental health treatment place and get direction from there. Maybe call the back of their medical card.
Mm-hmm. And if their child, would you go to the school, to the teacher, or what would you do if the child needs help?
Maybe reach out to the counselor or my child's pediatrician, get a referral.
Very good. So again, this is practical. If a parent is feeling like they need support, and let's say, so they look first for their, whatever is the mental health referral on their insurance card, correct?
Mm-hmm.
All right. And then the next thing, if it's for the child, they go to the school counselor or
they would call the insurance on the back of their child's medical card.
Very good. And Nicole, what would you advise? I mean, what are you telling people as they head back into these times that we're facing? What are you offering them? What kind of guidance?
Yeah. So I do agree that there is a shortage of professionals from psychiatrists all the way down to school counselors, et cetera, who provide mental and emotional support. What I would do is expand on what Ms. Henderson said, and also just remind people to keep asking. So you might go to a source and might not get the answer you need, and another one and another one. It takes resilience to keep asking for what you need. You may have to try different sources to get what you need. As you know, one of the things that I train people or talk about is whole life wellness. So there's not just one area of our lives that need attention, it's all of these areas. And certainly in the age of COVID, as we said, the silver lining is that we're able to have these conversations and use this language that we haven't been able to use before. But the challenge is that there's no one family or one individual that can resolve all of these issues. And there's no such thing as going back to normal. There's no back to normal. There's only our new normal. And so I would just really encourage people, if they're having any kind of trouble, especially for our little kids, right? When we talk to our little kids, we tell them to speak up if they need help. It's okay to ask for help and to point them in different directions. And that's true for adults as well. I would say also just to lean in your natural supports. So as Ms. Henderson was speaking, one of the things that I was thinking about is I've been approached by a couple of churches for mental health support. I've asked pastors, what's your greatest need? And they said, we need counselors. Marriages under COVID, marriages are crumbling. And not only are people just having general emotional problems, but financial problems and relationship problems. And so there are needs there as well. And maybe your child is involved in sports activities and it's still summer. If they have summer camp, that might be a place where people know of resources for support if you need them. So again, just keep reaching out and asking in your own social network. There's information available there that can help you, and don't be afraid to ask, and don't feel like you've asked too many times. Keep going until you get what you need.
I think I have to agree with Dr. Dana too, that one of the benefits is that it's not embarrassing to talk about. You might need some help now, right? It is perfectly normal during these times to reach out and to get help. It's not embarrassing. It is actually.
Have you seen that commercial that the ad council does? It has a cute little jingle. It talks about whatever kids you're talking. And it encourages people to check in with your friends and family to see how they're doing and to have those awkward conversations. So I definitely agree. It's so important that we keep having.
Absolutely. And we have spent a good deal of time here talking about the mental health, which is wonderful. I'm going to end with, and if anyone has anything pressing they didn't get out, please let me know and we'll give you the opportunity. But I'm going to end with a tough question that come in from Anonymous. There were so many questions that came in, I couldn't get to all of them, but they said, absent a vaccination and mask mandate in the schools, how do teachers and administrators deal with peer pressure and inter-student conflict over this issue? I mean, as you pointed out, Dr. Christopher, we're divided on this. I happen to think there are more people on the get masked and get vaccinated side. I see that even in the letters I'm getting and the op-eds, that pendulum has swung. People want to be safe, but that's going to be a source of conflict inside the schools. How are you going to deal with that? How are you preparing for that? I'll ask. I don't think it's as much of a problem in Harrisburg, but Dr. Christopher and maybe Rich can sign in here.
I do anticipate we will have some challenges, just based on the dialogue we've had with, some of our families. But, I also think that kids want to be in school. And kids do a lot of things in school. They follow the rules in school, usually, even if they don't like them, in general, a lot of kids do, And so I think trying to work through that process, I mean, the students just want to be at school. And I think we'll be fine once we get in here and get the doors open and get moving. I mean, it's been interesting to talk to our teachers union because that, they definitely are divided as well. I mean, I think we have staff members who are divided on the issue, and there's some real challenges, I think, even internally there with some of our staff. But, we certainly are working our way through that. I think if we just keep our eye focused on, we want kids in school, we want to stay in school with them, we'll make it out of it. We'll be fine. We just have to keep getting back to that as the vision. I think it's real easy to get, out here on the edges and get all concerned about random things. But if you just, okay, is this going to keep our kids in school? Is it going to make sure that they're safe? I mean, I think you can always drive back to that. And hopefully once we get the school year started, it'll calm down a little bit.
Yeah, Rich, did you want to add something about how, I mean, I'm sure teachers aren't all on the same page either.
187,000 members. No way are they all on the same page. But I will tell you, the overwhelming messages I'm getting from them is they have been glad that we've been following the CDC regulations and that we are continuing to do that. But yes, I get those few messages of disagreement, we'll call them. But when Superintendent Christopher was talking, I actually remembered a conversation that I had with my mother when I was in my crazy teen years and talked about my rights, and this is my right. And my mother sat me down and had one of the most memorable conversations I ever had with her. She told me that, yes, you do have your rights, but in this family, the first thing we have is responsibility, and responsibility to each other. And I think that's how we have to guide these conversations, is the way my mother did that with me, that we talk about what is our responsibility to our students, to their learning, to the school communities. And that's the question that has to be asked of some people. Is your rights more important than your responsibility?
Absolutely. And one of our listeners or viewers has said, try also paying attention to actual medical articles and advice. That's where people who are authoritative and really know what they're talking about, doctors, medical associations, that's where you get your information. Because there's a lot of back and forth here about masks. There's someone actually talking about masks doing more harm than good. Then masks are more dangerous than COVID, which is completely untrue. That's the kind of thing that you have to be careful where the source of your information is coming from. But we got to remember that a lot of people are trauma informed. So we've got to also approach it in a way that's going to pull people together. But you guys have been absolutely magnificent. You've shared so much information here. We want to wish our superintendents all the best as they head back into what's going to be a challenging year. Same for you, Rich. The teachers are so dear to us. We need you guys to stay strong. And we want to also make sure you feel appreciated because you're going to have a challenging year as well. And of course, our parents, Lavette, hang in there. I know you're going to be out there trying to talk to parents and to convince them to be vaccinated. Do you want to give one final say to get people vaccinated?
Do it for your children. That's it. We have to be here to be able to raise our children. So that would be the only message that I would put out.
I think that's a good message. And I want to thank Nicole Kirksey and Dr. Dana for their contributions to helping us understand the emotional and mental health issues. So with that, I'm going to let you have a great evening. And thank you again profusely for taking the time to speak to our community. Goodbye, everyone. Goodbye, readers. Bye-bye.